Everyone, how are you? And you are welcome in the second pre-revision for the KAPS exam, the coming November exam. This is the last free revision for this version. We will discuss today another 30 questions regarding to the exam from paper 1 and paper 2. And as usual, I will make all of you mute. And at any time, if you want to ask, please open your mic and ask about the question. We will start now with the first question, and as usual, this will be recorded and I will distribute it after we finish. Let us start with the first question today. At what dose does dopamine function as a positive inotropic effect? As you know, dopamine can be used for several purposes. Dopamine, when you inject it in the intravenous injection, can it pass the blood-brain barrier? The answer is no. So when you inject it as intravenous bolus or infusion, dopamine cannot pass the blood-brain barrier. Okay. We have several doses of dopamine. One of them will lead to the positive inotropic effect. What is this dose? We have three types of dose: low, moderate, and high dose. The low dose below 5 microgram per kilogram per minute. Moderate in between 5 to 10 microgram per kilogram per minute. While the high dose over 10 microgram per kilogram per minute. Okay, each of them will give a specific pharmacological effect. The low dose will lead to diuretic effect, will increase the urinary output. The intermediate dose or the medium dose will lead to positive inotropic effect, will increase the force of contraction of the heart. Therefore, this dose is the dose that's used in congestive heart failure. When we use it in decompensated congestive heart failure, the dose of dopamine will be from 5 to 10 microgram per kg per minute. Okay, those are the three doses of dopamine. The high dose will lead to vasoconstriction. So this is contraindicated for congestive heart failure because vasoconstriction will increase the load over the heart, which we does not need it. We don't need these doses. So the middle dose or the moderate dose is the recommended dose for heart failure. The second question. Here we have a structure of propylene glycol. Which of them is a propylene glycol? And we have another one repeated in the last exams. So A, B, C, or D? Yes. It is D. This is the propylene glycol. Let us analyze it. Propylene means propyl. So it contains 3 carbons. 1, 2, and 3. While the first one is ethylene glycol. It contains ethyl or 2 carbons only. Okay. In the past exams, the couple of exams or the last exams, they asked about what is the structure of polyethylene glycol. So in this case, we'll take this one, the ethylene glycol itself, and repeat it This is one unit, ethylene glycol, and repeated with several times to make the polyethylene glycol. So this is the structure of the polyethylene glycol. Which of the following is the most common metabolizing enzyme for clopidogrel? Unfortunately, you should know some drugs and their cytochrome enzymes that metabolize them. As you know, we have three expressions: substrate, inducer, and inhibitor. Inhibitor to the cytochrome. The cytochrome 450, P450, is a family, includes several types or subfamilies of the cytochromes, including 3A4, 2C9, 2C19, 1A2, and so on. Okay. The word substrate means that the drug that metabolized by the enzyme, by certain cytochrome. When the drug is metabolized by the cytochrome, we call it substrate. Okay. Inducer means the drug that enhance the action of the cytochrome. Inducer means the drug that enhance the action of the cytochrome. Okay, while inhibitor means the opposite, the drug that inhibits the action of the cytochrome. Okay, here he asks about which is the most common metabolizing enzyme for clopidogrel, or by another way, the question may be what is, or clopidogrel is a substrate to which enzyme? The question may be changed into clopidogrel is a substrate to which enzyme? Cytochrome 3A4, 1A2, 2C19, or 2D6. Okay, it is a substrate to cytochrome 2C19. This cytochrome will convert clopidogrel into its active metabolite, its active form. By the way, let us take some important or some common cytochromes and their actions. For cytochrome 1A2, one of the most common inducer to cytochrome 1A2 is, yes, smoking or tobacco. Tobacco is an inducer to the cytochrome 1A2. For 2D6, one of the common substrate to cytochrome 2D6 is perfect, codeine. Okay. Warfarin and phenytoin are substrate to which cytochrome? Cytochrome 2C9. 2C9. However, they may be metabolized by other cytochromes, but this cytochrome is the most one. Okay, so you are right here. You are right. It is metabolized by other cytochromes like 2C9, 2C8, 2C19, 2C18 as well. But the most common is 2C9. Okay, so if we have choices including those cytochromes, the best choice would be 2C9. Okay? Let us see the next question. Which antidepressant is most sedating? Here we are talking about which type of antidepressant that leads to sedation. Mostly we are talking about tricyclic antidepressant. Why? Because tricyclic antidepressant has anticholinergic and antihistaminic effects. The antihistaminic effects leading to sedation. Which of them has highest sedating effect? It is nortriptyline. Including those choices, fluoxetine is not tricyclic antidepressant. Duloxetine is SNRI. Here SSRI. Citalopram, it is SSRI. Okay, while nortriptyline is tricyclic antidepressant, which has anticholinergic and antihistaminic side effects, which leads to sedation. All the following are metabolic effect of hydrochlorothiazide except hydrochlorothiazide is one of the thiazide diuretics. Thiazide diuretics leads to 3 hype and 4 hyper. What are those 3 hypo? Hyponatremia, hypokalemia, hypomagnesemia. While what are the 4 hyper? Hypercalcemia, hyperglycemia, hyperlipidemia, and hyperuricemia. Those are the 4 hyper. While loop diuretics, you can change the calcium here from the hyper into the hypo. It will deplete calcium. Let us see the choices, then we have the ability to choose the right answer. Increase potassium excretion. Yes, of course, it is right. Hyperglycemia, hyperuricemia, hypotriglyceridemia, which is not an effect of hydrochlorothiazide. Let us see this calculation problem, which is an easy but having a small trick. Griseofulvine 50 grams added to glycerin 20 milliliter to form a paste. The density of glycerin is 1.25 gram per milliliter. The final concentration of griseofulvine in this paste is what? He needs to calculate the final concentration of griseofulvine. The small trick here is that the glycerin is not a solid, it is a liquid. So we need to know the corresponding grams of 20 milliliter. Then, after calculating this, we have the ability to know the total weight of the paste and then see the percentage of griseofulvine into the total weight or in relation to the total weight of the paste. So the first step here is to convert this milliliters, 20 milliliters into grams. According to the density of glycerin, every 1.25 grams equivalent to 1 milliliter. So 20 milliliter equivalent to how many grams? It will be 25 grams. Okay. Therefore, the total weight of the paste is 50 grams of griseofulvine plus 25 grams of glycerin. So it is 75 grams. Now we have the ability to calculate the concentration, weight per weight. 50 grams present in 75 grams of the paste. So the 100 grams of the paste containing how many grams of griseofulvine, or the percentage of it will be 66.7%. Okay, 66.7%. Which of the following is not metabolized by glucuronidation? As you know, glucuronidation is the most common reaction or metabolic reaction of phase 2 metabolism. What is the most common metabolic reaction for phase 1? Oxidation is the most for phase 1. Okay, while for phase 2 it is glucuronidation. What is this glucuronidation? Glucuronidation is a conjugation between glucuronic acid and the drug. This conjugation means attachment or binding of the glucuronic acid to a specific functional group which present in the drug. So if the drug containing this functional group, it has the ability to bind to glucuronic acid. What are those functional groups? The most common functional groups are carboxylic group, OH, NH, or amide, those, or SH. Those are groups that can attach it to the glucuronic acid. If they found in or if they present in the drug, they will do this metabolic reaction, glucuronidation. Phenol containing OH, carboxylic acid, acetaminophen, while alkenes does not contain the functional group that bind to glucuronic acid. What is alkenes? They are hydrocarbons that containing C double bond C. This is the alkenes. So alkenes not metabolized by glucuronidation. It may be by oxidation. Okay. The highest capacity of pulmonary volume. Here we are looking for a term describing this definition. Tidal volume, vital capacity, forced expiratory volume, or residual volume. Yes, it is vital capacity, which is the highest capacity of pulmonary volume, the highest capacity of the lung, or the maximum volume that the lung can accommodate. What is the normal rectal temperature? Is it measured in the evening or about the same as normal oral temperature, or lower than oral, or higher by 1 degree? Yes, it is higher by 1 degree than the oral temperature. Let us see a question from the stereochemistry. Here, he needs to know the relationship or what is the type of isomerism between the isomer A and isomer C. This and this. Okay, let us draw them beside each other to this is the A, the isomer A, and the isomer C here, CH3, CH3, H, H, ClNO2. This is the isomer C. What are the 4 characters that helping us to get the decision? First one, the presence of chiral center. Does those isomers contain chiral centers? Yes, they contain 2 chiral centers. This one and this one. Those are the chiral centers. The second character, the relation between them regarding to the mirror image. Are they mirror image to each other or not? Here they are not mirror image. They are not mirror image to each other. The third character regarding to the superimposed. Are they superimposed or not? When you put the isomer A over the isomer C, are they superimposed or not? Of course, they are not superimposed. Why? Here you'll find Cl over Cl, but here in the second chiral, the H will be over NO2, while NO2 will be over the H. So they are not superimposed. Okay. What about the fourth character? Fourth character regarding to optical activity. Are they optically active or not? Okay. How can we know? Firstly, we should check, are they mesocompound or not? If they are mesocompound, so they are not optically active. If they are not mesocompound, so they will be optically active. To be mesocompound, the first half should be mirror image to the second half. If you bend the compound over itself, the upper half should be mirror image to the lower half. In both isomers, it's not present. They are not mirror image. So they are not mesocompound and they are optically active. Okay. The four characters here means that they are diastereomers. The four characters is four diastereomers. So the relation between A and C, it is a diastereomer. Okay. By the way, if we see the relation between A and B, here the same characters, two chiral centers, but here the difference is in the mirror image. They are mirror image to each other, making A and B are enantiomers. Okay, A and B are enantiomers. Also C and D, they are enantiomers. While B and C, B and D, B and C, A and D, all of them are diastereomers. Okay? Which is safe in pregnancy? Acyclovir, lisinopril, sulfonamide, warfarin. Here it seems to be easy question because the choices are very easy. We can decide that lisinopril as an ACE inhibitor, sulfonamides, and warfarin, all of them contraindicated in pregnancy. So the remaining will be acyclovir, which is the more safer or the most safest one regarding to those choices. This is a calculation one. You are to prepare 750 milligrams medication in 75 milliliter of infusion. For infusion for 30 minutes. Using a dropper. 10 drop set means this expression means 10 drop set. Every 10 drops equivalent to 1 ml. This is the meaning of this. How many drops per minute will that be? So the rate of infusion by drops per minute, not by milligram per minute. So firstly, we need to convert this dose into milliliter per minute, then we can convert it into drops per minute. Okay. The 7 50 milligrams present in 75 ml. This 75 ml injected through 30 minutes. So the total bottle, the 70, which contains 75 or 50 milligrams, injected into the patient through 30 minutes. Every minute, every 1 minute, how many milliliter will be injected? You should divide 75 over 30. It will be 2.5 milliliter every 1 minute. Here we have the dropper set. Every 10 drops equivalent to 1 milliliter. Okay, every 10 drops equivalent to 1 milliliter. And we inject 2.5 milliliter per minute. So how many drops? Just multiply 2.5 by 10 to be 25 drops per minute. Okay. Let us see the next one. Low molecular weight compound that can or that act as immunogen after chemically complexing to a large molecule or cell surface is called. This definition of which term? Hapten, haploid, diploid, or immunogen? Yes, of course, it is hapten. Hapten is a small particle, does not exhibit or induce any immune response. But when it binds a large molecule like proteins, it will cause immune response. So we call it hapten. The following is prodrug. Which of the following is a prodrug? Ethinyl estradiol, hydrocortisone, spironolactone, or testosterone? The word prodrug means that drug that has no efficacy, clinical or therapeutic efficacy, but when administered to the body, it should convert it into its active form. So ethinyl estradiol is the answer here. Hemolytic anemia may be resulted from the treatment with. Let us firstly revise what is the hemolytic anemia. Hemolytic anemia is a disease that leads to destruction or hemolysis of the RBCs. It can be caused by two reasons. The first one is genetic. The second one is deficiency of glucose 6-phosphate dehydrogenase enzyme. This enzyme is responsible for prevention of hemolysis of the blood. Once this enzyme is not present, the blood may be hemolyzed or destroyed. Some drugs may lead to deficiency of this glucose 6-phosphate dehydrogenase, so hemolytic anemia may be induced. The question here, hemolytic anemia may be resulted from treatment with what? Or by another statement, what is the drug that leads to deficiency of glucose 6-phosphate dehydrogenase, or which drug leads to hemolytic anemia? Doxycycline, clonidine, methyl dopa, amlodipine. The first drug here is methyl dopa. Can you give me another examples of drugs that may lead to hemolytic anemia? Levodopa. Yes, cephalosporins. You are right. Okay, those drugs may lead to hemolytic anemia. Another question about the chemistry and stereochemistry. Here, the following structure is non-superimposable on its mirror image through R and S configuration. And this optical isomerism is defined as, we just mentioned it here, mirror image and non-superimposed. Also, it is chiral and optically active. So it is enantiomer. How many milliequivalents of magnesium are present in 50 ml of 20% magnesium sulfate solution? Number 16 again. Here we have two isomers, both two having one chiral center. They are mirror image to each other. Okay, mirror image here, the H here and H here, CH3 and CH3, OH and OH. So mirror image to each other. What else? Not superimposed. If you put one of them over the other, they will not be compatible or matching each other. So they are not superimposed. And also they are optically active. Those four characters for enantiomers.
Doctor, please, optically active, I need to understand it again.
Optically active. How can we know is it optically active or not? First step to know that is see if they are meso compound or not. To know that, firstly, you should put a first step. If we have odd number of chiral centers, like 1, 3, 5, 7, and so on, directly the compound without checking, it will be optically active. Okay, here we have one chiral center. So directly without checking, is it meso or not? It is optically active. If we have even number, like the previous example, even number of chiral centers like 2, 4, 6, 8, and so on. So we need to check, is it meso compound or not meso compound? If it is meso compound, so it is not optically active, or we call it optically inactive. If it is not meso compound, so it is optically active. Okay.
It's optically active.
Let me complete this. Meso compound, how can we know is it meso or not? Meso compound means if you bend the compound over itself, the upper part and lower part. This is the simplest way. If you bend it over itself, it will represent a mirror image. So the upper part is a mirror image for the lower part. Okay. So in this case, it is mirror image and meso compound and optically inactive. Like what? Like the following compound, COOH, and here COOH, and here we have OH, OH, H, and H. This is the tartaric acid. Okay. If you divide the compound into two halves, the upper part typically like the lower part. So this is a meso compound. What about the following? The same compound, COOH, COOH here, OH here, and OH here. Is it meso or not?
I think no.
No, because if you bend the upper part over the lower part, it does not show any mirror image. So this isomer of tartaric acid is optically active. It is not a meso compound. While this isomer of tartaric acid is optically inactive. Okay? And please again differentiate between the word optically active and therapeutically active. Optically active does not mean that it is therapeutically active. Okay? Or
Yeah.
by another statement, therapeutically active does not mean that it should be optically active. It may be optically inactive, therapeutically active. Okay? So there is a complete difference between the word therapeutically active and optically active. The optical activity, we are discussing a physical character only of the compound that may affect the efficacy of the drug. It may be active therapeutically or not. Okay? Hmm. You need anything or any other thing about a meso compound and isomerism and optical activity?
No, doctor. Okay.
Okay. Uh, I have another question in the chat about what are the tests for hemolytic anemia. This test is called KAPS test. KAPS test for hemolytic anemia. What does it do? KAPS test differentiate between the reason of hemolytic anemia. Does not give the diagnosis of hemolytic anemia because we have already the diagnosis. We have hemolytic anemia. The patient here coming with hemolytic anemia. But we need to know, is it due to genetic defect or deficiency of glucose 6-phosphate dehydrogenase enzyme? This is the test, KAPS test. KAPS test positive result means there is a deficiency in glucose 6-phosphate dehydrogenase enzyme. Let us see this calculation again. How many milliequivalents of magnesium ion are present in 50 milliliter of 20% magnesium sulfate solution? The first step here is to know the weight of magnesium sulfate in order to use the formula of milliequivalence equal weight over molecular weight over the valency. How can we know the weight of magnesium sulfate? From this percentage. So we need to calculate the percentage, means every 20 grams of magnesium sulfate present in 100 milliliter. But we have a 50 milliliter. So what is the weight of magnesium sulfate here? It will be 10 grams or 10,000 milligrams. Why we convert here? Because milliequivalence needs the weight by milligrams. Okay, now we have the ability to use the formula. The formula saying that the milliequivalence equal weight in milligrams over molecular weight, we have it, over the small n. What is the small n in this case? It is 2, the valency of the positive ion multiplied by its count. How many magnesium ions present in the molecule? It's only 1. So the small n here equal 2. Therefore, the 10,000 will be divided by the molecular weight over 2. It will be 81.3 milliequivalents. Okay, so this is the right answer for this question.
Right.
Yes.
Can tell how the balance is to because we will multiply the values of magnesium sulfate and oxygen together.
I'm sorry, I can't hear you clearly. Your voice is not clear. So either you can write the question in the chat or try to say it again. Okay, if you write it in the chat, I will answer it. Is how the valency is 2. Yes, this is from the periodic table. Magnesium ion have the valency of 2. You should know some ions and the valency of them from periodic table. Just the common ions like sodium, potassium, lithium, magnesium, calcium, zinc, okay, aluminium. Those are the most common ions. So you should know the valency of them. This group is positive 1 or 1. This group is 2. This aluminium is 3. Okay, so they are a basic information that you should know from the periodic table. Which of the following is least cardiotoxic NSAID? Least or lowest? Least here means either lowest or not. So any question in the exam having this word, the least, you can consider it as the lowest or not causing. It may be this or this. So let us see the choices here: naproxen, meloxicam, celecoxib, and diclofenac. Of course, it is naproxen. The question may be coming by other choices. Here, they ask about only the NSAIDs, but some other questions or some other choices in several models of the exam containing other drugs like opioids. A patient having heart disease and needs an analgesic. Which of them is more safer? Okay, which is more or most safest or safer drug for a pain for a patient having cardiovascular disorder? And the options or choices may include opioids like morphine, tramadol, naproxen, and other choice. So here naproxen still the answer. Okay, so either this or this, the naproxen is the answer for this question. The last part of the small intestine, I think, is a very easy.
ആണോ പറയാം
This fundus is a part of the stomach. Ileum, which is the last part of the small intestine. Jejunum is the first part, while jejunum is in the middle of the small intestine. Second part of the small intestine. It is jejunum. Most cardiotoxic, we answered it. It was naproxen. I'm sorry. Yeah. Most cardiotoxic here is the celecoxib. If we ask about most, here the answer should be celecoxib. Thank you for your question.
Doctor,
Yes, please.
this question. Which part have the highest absorption of medication?
Drug absorption and food absorption. Which part has the highest drug absorption? It is duodenum. Okay. While food absorption is jejunum. Okay. Yes, the celecoxib and coxib family carry a black box warning about cardiovascular disorder. The patient who having cardiovascular disorder should not receive this drug, celecoxib or validoxib or coxib family, any drug related to this group. Next question. Find the ratio of ionized to unionized drug species at pH 7 with the drug having pKa 5. Is it 100 to 1, 150 to 1, 1 to 100, or 10 to 150? How can we know this? To calculate this, let us use the formula of the pH of buffer system. pH equal pKa plus log ionized over unionized. We need to calculate the ratio, this ratio. So let us compensate with the value of the pH and the value of the pKa. 7 equal 5 plus log ionized over unionized means that the log ratio equal 2. If we remove this log, so the ratio equal 100 or 100 over 1 means 100 to 1. Which one is 100? Is the ionized. 2 unionized. So the ratio is 100 to 1. Okay. You can use your calculator for removing log. How? By pressing shift button, then log. You can try it with me now. Shift log 2 equal 100. Okay. If you don't know the log value, you can use your calculator in this case. Shift log 2 equal 100. Log equal 2 means 2 zeros. Like if we have 3 means 3 zeros. 4 means 4 zeros, and so on. Okay. Yes, if the answer is 2, means 100. If the answer is 1, means 10. 1, 0. So the answer is 10. Here, 1,000. Here, 10,000. It is a mathematical calculation. If you don't know that, you can use the calculator by using the bottom of shift, then the bottom of the log, then press the value, 2 or 1 or 3 or whatever the value, you will get the value of the ratio. Okay. By the way, if it is positive result, I mean the log value is a positive result, this means that the upper one higher than the lower one. If negative result, it's the opposite. The upper one is lower than the lower one. The next question. Which decrease the tension between solid and liquid? Question related to the pharmaceutics. The tension between the solid and liquid is called interfacial tension, which is the force per unit length that acts along the interface between two phases. The interfacial tension depends on the cohesive forces within each phase and the adhesive force between the phases. Okay? If we have two phases, one of them is solid and the other is liquid. But the solid does not dissolve in the liquid. So here we need a substance that decreases the interfacial force between them, which we called it wetting agent. It is wetting agent. While if we have liquid and liquid, which are immiscible to each other, what is the interfacial tension, or what is the substance that decreases interfacial? Yes, it is surfactant or emulsifying agent. Surfactant or emulsifying agent. So here the answer is wetting agent. Therefore, we use wetting agent in suspension, while the same substance called surfactant when we use it in emulsion. Okay, some substances can be called or can called wetting agents when we use it for suspension, and by the same way, the same substance can called emulsifying agents if we use it for emulsion preparation. What about this structure? Can you expect what is this structure? It contains sulfonamide group. Yes, perfect, Albert. Thank you. Firstly, it contains sulfonamide. Second thing, this part, C double bond O, N, N. It is a urea. So it is one of the sulfonyl urea. It is antidiabetic agent. So the answer is antidiabetic agent. The question also may be changed into what is the side effect of this drug? Weight loss, hypoglycemia, hyperglycemia, or any other side effect. Of course, it is hypoglycemia. And weight gain, not weight loss. Let us see this calculation problem. Approximately 50% of cloxacillin, 50% of cloxacillin is excreted unchanged in the urine. When we have this term or this expression, excreted unchanged in the urine, means that the kidney function does not affect the excretion of this part. Or by another statement, this part will be excreted whatever the kidney function. Is it good or not? Is it acting efficiently or not? 100% or 0%? This 50% of the drug will be excreted whatever the kidney function. Okay? All of these meaning, those meaning by the excreted unchanged. Let us complete the question. If the normal dosage schedule for the cloxacillin is 125 milligrams every 6 hours, and the patient with a renal function of 20% of normal should receive. Here we need to change the dose, to adjust the dose. How can we make the dose adjustment for this patient? Let us see. So after dose adjustment calculation, we can know the new dose. If the kidney has 100% efficiency, so 50% will be affected by the kidney and the other 50% does not. Okay. While if it is 20%, so here, how can we calculate the dose adjustment? 20%, the 50% of the drug affected by the kidney. So when it was 100% efficacy, it excretes 50%. So when it is now 20%, it will excrete 10% of the drug only. While the 50% still unaffected. So the total excreted part will be 60% of the drug. When we add this 10 to 50, it will be 60% of the drug. Therefore, the dose adjustment factor will be 0.6. 60% or 0.6. 60 over 100. So now we need to multiply the dose for normal patient with this factor, the dose adjustment factor 0.6, to get the new dose, which is 75 milligram every 6 hours. Okay? Yes, Lai. How come you asking about the dose adjustment factor or which one part?
The dose adjustment factor.
Yes. Let us understand it step by step. If the patient having normal kidney function, what is the amount excreted by the kidney? It is 50%. Yes. If the patient, the kidney function of the patient decreased to be 20%. Okay. So the drug, of course, will be affected. It will not excreted by 50% of the drug. But what is the new percentage that excreted by the kidney? It is 10%.
So we still have 40%.
Still have 50%?
40%.
Why 40? Here he mentioned that 50% does not affected by the kidney. So this 50% excrete either the kidney having the full function or zero function. Whatever the kidney function, still 50% will be excreted. Okay? We are working on the other 50%. The other 50% now becomes 10%. Why? Because if it is 100% kidney function, it will excrete 50% of the drug. And if it is 20%, how many percentage of the drug will be excreted by crisscross? 20 multiplied by 50 over 100, it will be 10%. Right? Okay. Right. So we have 10% due to the kidney function defect, plus the 50% which does not affected by the kidney. So the total drug excreted now is 60% of the drug. So we need to give 60% of the normal dose to be matching with the kidney function or the new kidney function. Did you got it now?
It's fine.
Still not. Still not.
I mean, why the 51st% become 10%? Because the 51st%, yes, this will be taken by body, not kidney.
Excreted by kidney. If the kidney is full function, it will excrete all of them. Okay, but now the kidney has a defect, cannot excrete all of them. what is the amount that the kidney will excrete from them? It will be
Okay. Yeah.
10%.
Mhm.
Okay.
Okay.
So this 10% added to the amount that the kidney excreted without change or
Okay.
does not affected by the
Mhm.
kidney. So the end result will be 60% of the drug will
Mhm.
be excreted from the body. The total amount will be 60%.
Mhm.
So we need to adjust the dose to be 60% of the original dose.
Okay.
Or the dose adjustment will
Mhm.
be 0.6. The factor will be 0.6. So whatever the dose, multiply it by 0.6.
0.6. Thank
Okay.
you.
If we change the question to be the following, the kidney function will be 80%. By the same way, by the same method, just change here from 20 to 80. So multiply 80 by 50 over 100 equal 40%. Okay. Then this 40% added to the 50%, it will be 90%.
90%.
In this case, you should
Mm.
multiply the normal dose by 0.9. Okay. And also you can change the question if this percentage changes into higher or lower dose. So higher or lower percentage. So you can change and try question with different values.
Mhm. Okay, thank you.
All the following are mixed agonist-antagonist opioid except we have naloxone, nalbuphine, buterphanol, pentazocine. Of course, it is naloxone, which is a pure antagonist. It will block the opioid receptors or receptors completely. So we use it only in case of toxicity, and we cannot use it in case of withdrawal symptoms. If we use it in withdrawal symptoms, it will increase the withdrawal symptoms because it will directly block the receptors and increase the withdrawal symptoms. How many antipsychotic, many antipsychotic drugs have strong antiemetic effect. This is why. Which pharmacological action or mechanism leading to this antiemetic effect? Muscarinic receptor, serotonin receptor, dopamine receptor, or histaminergic receptor. The blockage of which receptor is dopamine receptor, leading to antiemetic effect. Werner-Korsakoff syndrome. What does it mean, or what is this syndrome? This syndrome resulted from the deficiency of vitamin B1, which called thiamine. Thiamine will lead to this Werner-Korsakoff syndrome. The folic acid will lead to megaloblastic anemia, while ascorbic acid will lead to scurvy. Riboflavin will lead to photophobia. You have stock solution that contain 10 milligram of active ingredient per 5 milligram of solution. and the physician ordered a dose of 4 milligrams. How many milliliter of the stock solution will have to be administered? How can you solve a question like this? Here, firstly, the 10 milligram active ingredient present in 5 milliliter. So the 4 milligrams needed present in how many milliliter? They are present in 2 milliliter. So it's a very easy question. Mostly you'll find several questions of the calculation like this. Very easy questions. So don't be panic about the calculation. Just focus on the calculation. Try to solve them as fast as you can in order to have the calculation marks completely. Then easy to get it. What happens when you take a parenteral preparation that's not isotonic? If it is not isotonic, it is either hypertonic or hypotonic. Let us see what is the effect if one of them or both of them. For hypertonic, leading to what? Hypertonic means that its concentration higher than the RBCs. So it will make push of the fluid from the hypertonic solution into the RBCs, leading to
Hemolytic.
shrinkage. It will make a suction of the fluids because it has a hypertonic, so it will make a suction of fluids from RBCs, leading to shrinkage, not swelling. Shrinkage of the RBCs as a result from hypertonic solution. While hypotonic solution, the fluids transfer from the solution itself to the RBCs, so leading to swelling. This swelling leads to, after certain volume, leads to rupture of RBCs or hemolysis. Okay, those are the action of either hypertonic or hypotonic. Let us see the choices, then decide which is the right answer. It will lead to hemolysis of RBCs. Yes, it is one of the effects. Drug instability does not affect the stability of the drug or pH or absorption. So the hemolysis of RBCs will be the right answer for this question. Let us see the next one. Isotonic and sodium chloride 0.9% contain here. We ask about the conversion of this 0.9% into how many milligrams, I think, or how many millimoles per liter. Okay, he asked about how to convert from this 0.9% into millimole per liter. Just having the definition of 0.9%. 0.9% means 0.9 grams present in 100 milliliter. Okay, so 9 grams present in 1000 milliliter, the 1 liter. Here he need to calculate regarding to 1 liter. Number of millimoles equal the weight over the molecular weight. If we divide them, we will get 150 millimoles per liter. Please memorize this number because this question repeated several times. If you have this question, directly choose 150 millimoles per liter without consuming your time in calculation. If you memorize this number, you will directly choose the right answer without consuming your time in the calculation. The last question today. The following chemical structure is the type of essential fatty acid. And the bond between carbon number 3 and carbon number 4 is essential for its omega activity. As you know, for calculating the omega system, we start with the carbon on the other side, while IUPAC nomenclature starting from the carboxylic group. So here, this is number 1, number 2, number 3, and the first double bond in between carbon number 3 and carbon number 4. It is one of the omega 3. We have linolenic acid is an omega 3. So the answer is linolenic acid. Okay. Linolenic acid is an omega 3, while linoleic is omega 6. Eicosahexanoic acid also is an omega 6. Eicosapentanoic acid, the same. While oleic acid is omega 9. So the answer here is linolenic acid. Linolenic acid. This was the last question today. Still, we have 2 revisions or paid revisions in our full revision course. So if you want to join our revision or our comprehensive revision, you can join it from this link. Other thing I would like to announce about it, which is the mock test. The mock test, which mimic the real exam and contains other questions also from the real exam. The mock test designed to help you to manage your time in the exam and having a questions like the same real exam. You'll find it in our website, and the best way to do the mock test is to do the 2 papers in the same day after each other. Start with paper 1, then take a rest after paper 1 or optional rest for maximum 1 hour. This is the maximum time for the rest. Then start the paper 2 in order to mimic the same that what happened in the real exam. Then revise the performance or your performance. You will see the result and you will see the answers that you have got it as a right performance or a wrong performance. Okay. Inside each paper, you'll find the question, whatever its number, and the 4 choices. Okay. And here we have a bookmark. The bookmark here, if you sign over it, the count of the question, here we have 100 questions, the count will be marked. And you can go back to this question at any time to revise it or change the response or not. Okay. To access the mock test, you can go to the website newptech.com. Then press on the courses. Then choose the KAPS exam. Then choose the mock test. You'll find it. Okay. So this is the mock test. It will help you so much regarding to the KAPS exam to mimic and feel the real exam situation. Okay, plus other tests, you'll find them like calculation tests and chemistry tests and other CNS test and so on. So you can try any of them if you want. Finally, do you have any question about what we discussed or about anything regarding to the KAPS exam before we finish today?
Doctor, regarding the previous lecture, the revision, it is on website now?
Yes,
or
all of
still?
them present in the website. You can go to your account and open any of them. You'll find the new record present. All of them are present. And also this lecture will be present after we finish.
Okay. Okay. Thank you so much, Dr. Ahmed.
Any other lecture? Any other question? Sorry. Okay, I'd like to thank you so much for your attendance of this revision. And I
Hi,
hope.
Doc.
Hi, how are you?
Good. Please, I missed number 13.
Number 13. So let's go back to number 13 again. This one, right? Here, he asked about the low molecular weight compound, a compound or a small compound that when attached to the large molecule, especially or like protein, it will exacerbate an immune response. The immune response of the body will be exacerbated. This is what we call hapten. So this small molecule called hapten. Okay.
I got it. Thank you.
You're welcome. Yes, before we finish, last thing, do you have any question? Of course, I am with you at any time. So if you have any question at any time, you can directly send it to me at this WhatsApp number, and I will reply whenever it is possible.
Thank you, Doctor.
You are welcome, and I hope all of you having the good luck in your exam and finish the KAPS by an easy way, and see you again soon. Goodbye.
Okay, thank you,
Bye-bye.
Doc.
Thank you.
Thank you.